how to treat warts without a medicine and without even touching it. This is real science and it's not a voodoo treatment. Hello everyone, this is Dr. Mitch Freeman, MD. I'm a board certified family physician practicing in Yuma, Arizona. I've been a physician for 34 years and I'm here to spell out all my experience in medicine. I would like to share my knowledge with the rest of the world, especially in part of the world where there is no medicine and they have no access to expensive medicine. What is warts? Warts are a tumor-like growth, like on your skin, just like we all have gotten warts through our life. I've had warts throughout my life. So it's caused by a human papilloma virus. And it's a growth on your skin, typically on the fingers, anywhere in the skin. Some people get it on their genital and they call it external genital warts. It's caused by the same thing. Also, warts can happen inside the esophagus and the throat, and it could give throat cancer, and it can grow, warts can grow inside a woman's cervix and can cause cervical cancer. It's the main cause of cervical cancer in women. Actually, there is vaccines. It's a routine vaccine in America that we give to young boys and girls, either 2 or 3 vaccines of 2 or 3 shots, 2 months or 1 month apart, to immunize them against certain strains of human papillomavirus to prevent the warts from happening in the first place. But if you have a wart and you wanted to treat it, you can treat it the way I'm going to tell you. And this is something I discovered, and I'll tell you how the discovery came about and the story behind it. So I have at the time, a medical assistant came to me and told me that, tell me this story. My dad has a horse. His horse has warts all over his snout. And he took blood with a syringe from the horse, that same horse, and injected it into the muscle of that same horse. And a couple weeks later, the warts went away. How is that possible? At the time, I told him, I don't know. It could be a coincidence. But I kept thinking about it, And I'm a curious person, so I told her, I think there's some science behind it, and I would like to make an experiment. I remember at the time I had 2 patients, a man and a woman. The man had warts all over behind of his hands. At the time, I removed all his warts by numbing them and burning them all. They disappeared all, and a couple months later, they came back. And the other patient was a woman. She had flat warts all over her palms, both of her hands. And that's very painful to try to burn or to treat, because the traditional wart treatment is basically a destructive method. It's a barbaric destructive method. And it's painful. Basically, we burn them with either cautery, we freeze them, we burn them with chemicals, with medicine, cream, but that's a painful method. Imagine putting something that burns your skin over and over and over, and you'll have painful skin for weeks. So those 2 patients, the man patient that have warts on the back of his hands and the woman patient that have warts all over her hands, I called them and told them, I have an experiment I want to make. And I explained to them, I want to take your own blood with a syringe from your vein and inject it into your muscle. And I want to repeat it 2 months apart 3 times. So that's what I did. And lo and behold, the warts went away and the treatment was successful. And I've never heard of this treatment before. In human medicine, never heard of it, never read about it. And I decided to start using it and offering it in my practice. So when I have patients coming in, if they have a wart, I tell them the treatment for warts is I numb it and burn it. It could come back. I personally had plantar warts in my bottom of my feet when I was in residency. And I remember freezing it multiple times. I froze it on 7 occasions. So that destructive method that we use, it's not always successful, and it could come back and you have no control over it. But when I get patients, especially if they have genital warts, that's very painful and private to burn them in that area, or warts in like tip of the fingers, it's very painful to try to treat. I offer them this treatment, and whoever accept the treatment, I will do it to them. And honestly, I would say 9 out of 10 have been successful for the ones I followed. So what I do, all you need is a syringe. You draw blood. I draw about 2 cc's. And the same blood, right away you inject it into the muscle. And you repeat that 3 times, 2 months apart. And 9 out of 10, you'll get better. Now, please, if you're in NIH, if you're in a research center, if you're anywhere where you can duplicate this and research it to spread the gospel, spread the world, the word around the world, so everyone would know. The problem is, I doubt any company will do this research, because there's no one could make money on your own blood. It's not a medicine they can sell you for $1,000 a month. So there's no motivation, except if it's a government entity. If they believe me, they will do it. But they probably think I might be a cuckoo doctor practicing cuckoo medicine. And, well, whoever believes me will succeed and it will work, believe me. So my own scientific explanation for it is the following. What causes warts? Warts are caused by a virus. It's called human papilloma virus. And that virus causes growth or multiplication of the cells, and it multiplies and it causes the growth of the wart. And like I explained, people could have esophagus cancer caused by warts, or cervical cancer in women. The main cause of cervical cancer is HPV, that's human papillomavirus. That's why women get pap smear to check for cancer, and that cancer is caused by that wart. So when I was in residency and we were doing pap smears and cervical cancer treatment, if we see someone with an early signs of dysplasia or early signs of changing in the cells toward the cancer cells, what we do is we pinch the cervix with a very sharp tool really hard to like make it bleed and destroy that area. And that will trigger an immune response and will trigger immune system to recognize the virus and treat it. And a lot of time that will help treat the cervical dysplasia or the early cancer changes. So in human, the virus grow on your skin, but your immune system does not see it. And that's the problem. It's until the immune system see it, and it will defend it, and it will fight the cancer, the virus, and eradicate the virus. But when people have a growth of warts on their fingers, on their body, the immune system is not seeing it. So when you take blood out of your body, the blood in your body, when you inject it into the muscle, the way it goes is your immune system and your white blood cells will go, and we call them the macrophages, will go and engulf the blood cells and will process every protein in that blood. So if this protein is, this is friendly, pass, hold on. We've never seen this protein like a virus or any foreign body. We're going to make an antibody against it, and we'll make an immunity against this protein. And then friendly, hold on. This is not friendly. We're going to make antibody against it. So basically, when you inject blood into your own muscle, you're stimulating your immune system to recognize these viruses that are floating freely in your blood, and your immune system is not seeing it. So basically, it's your own immunization, your own vaccine. That's only if you have the warts. If you have no warts, there's no virus running in your body. But if you currently have a wart, you go to your doctor and ask him, please take a blood from me and inject it into the muscle. If they say, I don't understand it, I don't know, never heard of it, of course they're going to say that. Share this video and let them hear my explanation. And 9 out of 10 patients that I've given them and offered them this blood shot, they get better and the warts will disappear without even touching the warts. People, that's huge. To tell someone, I'm going to treat your warts without touching it. I'm just going to give you a shot from your own blood that doesn't cost you a penny. It's not a medicine you have to buy from the pharmacy, and it will work. So your own immune system will fight the virus, will recognize the virus, and will eradicate the warts. If you like this content, hit like and subscribe and press the notification bell to be notified with my future videos. I'll bring you my own experience in medicine that I collected through the 34 years of practice in medicine. Have a good day. I'll see you on the next video.